Hi there. So you or someone you care about has been told you have something called Barrett's esophagus. And you know what? It is totally normal to have a ton of questions. Over the next few minutes, we're going to walk through what it is, why it happens, and the simple steps you can take to manage it. Let's dive in.
Before we start, please remember that this is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always talk to your doctor or a qualified healthcare provider about any questions you have regarding your health.
Look, hearing a new diagnosis, any new medical term, it can feel, well, pretty overwhelming. But we're going to break this down together, one simple step at a time, so you can feel clear and confident about what's next.
All right, so let's jump right in. Part 1. What is Barrett's esophagus anyway?
Okay, to put it really simply, Barrett's esophagus is just a change in the lining of your esophagus. You know, that's the tube that carries everything you eat and drink from your mouth down to your stomach. It's not a disease itself, but more of a change in the type of cells you have there. So check this out. On the left, you see a normal esophagus. It's smooth, it's pink, but on the right, with Barrett's, that lining changes. It starts to look more like the inside of your intestines, and it often gets this distinct kind of salmon-colored look. The reason? It's your body's way of trying to build a tougher wall to protect itself from stomach acid.
And that really gets to the heart of it. Barrett's happens because your body is trying to defend itself from long-term acid reflux. Think of it like it's swapping out the regular wallpaper for something more heavy-duty and waterproof. It's a protective measure, even if it's not a perfect one.
So that's the what. Now let's get into the why. Why does this change happen in the first place, and who is most likely to experience it? Okay, so who is most at risk for developing Barrett's? Well, it turns out there are some pretty clear patterns here.
For starters, it's about twice as common in men as it is in women. Age is also a big factor, and the risk generally goes up for people over the age of 50. But beyond that, a few other key things come into play. The number one risk factor is having long-term acid reflux, what doctors often call GERD. Carrying extra weight, especially around your middle, smoking, and having a family history of either Barrett's or esophageal cancer can also increase the risk.
Okay, now let's tackle the big one, the one that's probably on your mind, the link to cancer. We're going to talk about this directly, because honestly, the facts here are very, very reassuring.
All right, if you only remember one thing from our time together, please let it be this. The vast, vast majority of people with Barrett's esophagus will never, ever get cancer. Let me say that one more time. Most people with Barrett's do not get cancer. It's so important to let that sink in. You want to see the actual number? For most people with Barrett's, the risk of it progressing to cancer in any given year is less than 0.5%. That is a very small number.
Now, to really understand this risk, there's one key word we need to know: dysplasia. It sounds fancy, but all it means is that some of the cells are starting to look a little abnormal under a microscope. If your doctor says no dysplasia, that's great. The cells have changed, but they are not precancerous. We just monitor it. If they find dysplasia, the cells are considered precancerous, and that's when your doctor moves in to treat them. This distinction is everything.
So how do we find these changes? With a really common and simple procedure called an upper endoscopy. A doctor uses a tiny little camera to look at the lining of your esophagus. It lets us see these changes super early, way before they could ever become a problem. It's all about being proactive and staying ahead of the game.
This brings us to the best part, what we can actually do about it. And the great news is, the management plan is really straightforward, and it puts you in the driver's seat of your own health.
Your action plan really boils down to 3 simple, powerful steps. Control the acid, make healthy lifestyle choices, and keep up with your checkups. Let's break each one down.
Step 1 is all about stopping that constant irritation. Your doctor will likely prescribe medication that reduces the amount of acid your stomach makes. This is so important because it helps prevent any more damage to the lining of your esophagus.
Step 2 is where you have so much power. This is all about the positive changes you can make in your day-to-day life. Things like managing your weight and quitting smoking can make a huge difference, not just for your esophagus, but for your overall health. Every healthy choice helps. And finally, step 3, attend your scheduled checkups. This is the key to peace of mind. Think of it as being a watchful guardian of your health. It ensures that your team can catch any little changes right away and handle them.
So, the takeaway is this. Barrett's is a manageable condition. The goal is to control the acid, monitor for changes, and just keep you healthy for many, many years to come. With this plan, the long-term outlook is excellent.
I want to leave you with a question to think about. What is one small, healthy choice you can make today to support your health journey? Maybe it's going for a walk or choosing water over soda. Every little step forward is a victory. Thank you for taking the time to understand this with me.